Hello guys, hello family, hello friends. This is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, in this video, first of all, Happy New Year guys. We are just a couple of hours before we enter the new year of 2022. So Happy New Year guys, and all the best for the upcoming year. So guys, I want to talk to the interns, the incoming interns. I'm talking about the guys who are going to be interns in January. So guys, once more, congratulations for being doctors. Yeah, you deserve it. You worked hard for it. And yeah, you're still hoping to get a swap. I hope that goes well as well. So guys, for the guys coming in next year, I just want to brief you. There's a video that I uploaded about 4 weeks ago where I was talking about the 7 documents that you need. I hope that you did listen to the video, you did watch it and actually listened to my advice. So I'm not gonna go back there. Now let's assume that you have all the documents and you have signed your contracts and now you're actually ready to start. So what to expect? So what's gonna happen is on your first day, they will divide you into 4 groups, and whether there's 13 of you or 15 of you in a group depends on how many interns are in that hospital. So in our in our group in Nelson Mandela we're 56, so we're divided into 4 groups, and the reason why they do that is because in your first year of internship, you have to do the big 4 rotations. You have to do the big 4 rotations first. So that is Gen Surg, Ops and Gynae, Pediatrics, and Internal Medicine. So you're gonna do those 4 rotations in your first year of internship. So some of you are gonna start with Ops and Gynae, some of you are gonna start with Peds, some of you are going to start with internal medicine, some of you are going to start with Gen Surg. And when they divide you into those 4 groups, unfortunately or fortunately, they won't consult you. So they'll give you a list and you're going to have to find your name. Look through and find your name and see where or what rotation are you going to start with. So that's what's going to happen. And in those 4 groups, you are not going to have liberty to choose who you want to be with. You won't have liberty to choose who you want to be paired with. So yeah, it's an opportunity to make friends, to make good friends, good clinical partners, and yeah, so you're going to be working with people that you have never seen before. It's people that didn't study who are not coming from your university or the university that you studied, and so it's gonna be new people. You're gonna find people that studied in South Africa in your group and those that did not study in South Africa. So it's gonna be a very nice mix, and you're gonna have to start to appreciate other people, how they do things, and sort of like understand how other people were taught and compare to yourself. And also it's gonna be also a good you're gonna be able to also sort of like gauge yourself and see where are you down there, are you with the others, or are you, so it's gonna be a good, not that you have to compete or anything, it's good to always know, so that if you think that people, they know a lot around you, and you think that you need to strengthen, then that's where you're gonna see that, okay, I need to strengthen there, because a lot of people that I work with, they know some things and I'm behind, so it's gonna push you. So you're gonna so it's gonna be very nice. So you're gonna learn from them and they will learn from you as well. So it's gonna be a very nice experience. You are gonna find people that will actually, you are gonna find interns that you're gonna be working with that will eventually become like family to you and all of that. So yeah, So guys, the rotations that you're going to be doing as a first year intern in 2022, there is no second year that you're going to be with. You're going to be the only ones. Your second years will be doing the rotations that you are going to do in your second year as well, which is that 6 months of family medicine, that 2 months of anesthesia, that 2 months of psychiatry, and that 2 months of orthopedics. So you won't find second years in your rotations. You are going to be the only interns. That can be a good and a bad thing. The bad thing about that is the fact that you guys are going to be on call. I think some of you are going to be on call tomorrow in some hospitals. That despite for interns, they don't have interns right now. So some of you are going to be on call tomorrow. And I think those who are going to be on call tomorrow, they already know that they're going to be on call tomorrow, which is the first. So you are going to be on call, guys, this week. I mean, the week that starts, from the first going forward, you guys are going to be on call. When we came, we had second years. So they did they did calls for the first month. They did calls for the first month, and we settled in nicely. They were so kind that they did the calls for the first week. First month? No, first week. They did calls for the first week. And so at least we had a week to settle, sort our things out, sort our accommodation out and everything. And yeah, but in your case, since you don't have second years, you guys are going to be on call. Those medical officers, registrars, they're itching to have you. They're desperate to have you, and all of that. So you guys are going to be on call. So like I said, in your second year, you're going to do those. So unfortunately, guys, you are going to have people that are going to be, fortunately, let me say, unfortunately, you're going to be the only interns there, and your seniors are going to be on you because they want the work to be done. Some of them will not be so understanding. Some of them will be understanding and actually bear with you and tolerate that you are new in the hospital, it's a new environment for you, and all of that. You don't understand why you can't put a live line. You don't understand why you are calling them because you can't you can't take blood, and you are struggling to take blood from a patient. Some of them will. So it depends who you're working with. I just hope that you're gonna find people that will be, even the ones that are gonna be patient with you, they won't be patient for a very long time. So my advice is that try to learn as fast as possible. Try to hit the ground running, and try to learn as fast. So guys, one other thing that I want to say to you is that internship is heavy. Internship is heavy. There's no doctor who will that you'll ever hear say that I wish I can do my internship again. You will never hear, not even one. Not even one. It's horrible. Med school is nothing compared to internship. When we're in medical school, we thought that at least because we're going to be getting paid, so it's going to be okay. When you are stressed, when you are under pressure, when you are sleepy and you are woken up to go and see a patient, the money doesn't even come to your mind. What you know is that now you are suffering. So you are going to work very hard. You are going to work with doctors who are passionate about teaching and all of that. And you're going to work with those that are just having none of it. So guys, so as you start your internship, just understand one thing, that you have the MBCHB from your university, but you are still a doctor under training. So there is no pressure. Don't put pressure on yourself. Don't put unnecessary pressure on yourself. Just learn as fast as you can, but don't put your pressure and be like, I'm a doctor, but I can't prescribe paracetamol. I'm a doctor, but I can't prescribe amoxicillin. I don't know the dose. I don't know the frequency. So don't put pressure on yourself. Unfortunately, when you come, there is no one who really expects you to be a doctor, because when you qualify for med school, yes, you are a doctor, but you can't treat any patient. You don't have the confidence, you don't have the clinical enough clinical experience. Even yourself, your confidence is just zero. So everyone understands, and majority of the times, the nurses, your seniors, they will put you on a negative as interns. They will put you on a negative, which is nice. That puts pressure off you. So they'll put you on a negative, and you're gonna have to, as you grow, you're gonna have to fight yourself out, grow, and leave the negative side of things and get to the positive, and try to cross to the positive, get to the zero. I mean, they're gonna put you on a negative. They will put you on a negative. They are so understanding that you don't know a lot, that they put you on a negative. They don't expect. So it's up to you to study, grab things fast, and actually be like, look, yeah, I'm here and I want to be a doctor, and I'm ready to be a doctor. I'm ready to learn how to be a doctor, because that's what internship is all about. It's about teaching you how to be a doctor. You've got all this knowledge from med school, but you don't know how to be a doctor yet, because you don't have the clinical experience, you don't have the clinical acumen, you haven't developed enough confidence to treat any patient. So that's what's going to happen. So everyone understands. The nurses, they understand. The doctors, they understand. Sometimes when you make a diagnosis that or whatever, or a finding that they didn't expect you, they'll be like, oh, that's good, that's awesome, because they didn't expect that you would. So yeah, it's an opportunity to actually build yourself as a doctor. There isn't a lot of pressure. One thing that I can tell you, you are gonna work very hard. You are gonna work very hard, and that's just the rate of internship. For those who are sensitive when it comes to gaining and losing weight, it's gonna happen. Your weight is gonna fluctuate. That's what internship does to you, and internship is gonna mess up a lot of your good sleeping habits. It's gonna mess up your healthy eating habits. It's gonna mess up your exercise schedule, exercise schedules, your good exercise schedule. It's gonna mess that up. Did I mention sleeping patterns? Yeah, a lot of things. Yeah, because the time that you have as an intern is you just want to go and sleep. You just want to go and sleep. Okay. So another thing is, as you rotate from one discipline to another, I don't want to lie to you. You are gonna find departments that are very organized. You're gonna find those that are just a mess, and you're gonna find those that will actually teach you, and those that will actually not care. And also within the same department, you are gonna find doctors that are actually gonna teach you, doctors that are gonna be patient with you and teach you. You're gonna find those that do not care. But your learning during internship, it starts and ends with you. It starts and ends with you. Learning in internship is a very personal thing. There's no one who's gonna be behind you on your neck and asking you questions and asking you to read and blah 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 blah. If they happen to ask you something, depending where you are, if they happen to ask you a question and you don't know, they won't beat you for that. They won't shout at you for that. They'll just leave you. What you need to do is to go and look that up and make sure that you know it for yourself, and not for anybody but yourself, and for your patients, obviously. So yeah, so you need to, one other thing that I want to encourage you to do, try to learn when no one is teaching you. Try to develop an ability to learn when no one is teaching you. Try to learn when everyone is quiet, when no one is saying anything to you, when no one is not teaching you. And you can do that if you want. Flipping through patients' files, checking the diagnosis. I mean, personally, I can learn from just watching how things are done in the clinic, from just watching how things are done during the ward rounds, what they are writing, and also when we receive a patient. What I used to do when we receive a patient from the base or from the district hospital, I would look at the diagnosis, look at the referral letter, and try to understand the doctor who saw this patient at the base. Why have they made? What made them to make this diagnosis that they have made? And then I will see, oh, okay, the patient came in like this, and what did they do? Because the patients that are seen at the districts right now, whilst we are still interns, are gonna be the same patients that we're gonna be seeing. I mean, if you find a patient that's been referred from the base, a step neck, step abdomen, those are the patients that you're also gonna see. So it's actually nice to see, read through the notes, and actually be involved in the management of that patient and see what the surgeons, for instance, are gonna do here, so that when you refer, you know exactly what's gonna happen on the other side. So yeah, and yeah, I don't want to lie. There are seniors that are happy to answer questions. There are seniors that are reluctant to answer questions when you ask them stuff. So it's such a personal thing. Some of them, there are seniors that you're gonna be on call with that will actually teach you. That will actually, they will teach you so much that even if there's no emergency, your line is not moving. They will sit on that patient and teach you. And then there are those that are just concerned about finishing and seeing all the patients and let everyone go to sleep if it's a call or whatever the case may be. So another thing, you need to understand your seniors. They are also frustrated because they are also afraid of their consultants. So understand them as well. Yeah, guys. One other thing that I want to warn you guys about is this is one of the things that I've come to realize. I've come to realize that as a doctor, you know the kind of doctor you want to be. You know the kind of a doctor you want to be. You want to be that good doctor. You want to be that doctor that's puts in 120%. You want to be that doctor that actually goes an extra mile for the patients. You want to be that doctor that is a good team player, that is understanding and all of that. You want to be that doctor. But there are three things that I've come to realize that can mess that up. They can actually take away the passion that you have, of practicing medicine, of being that good doctor and all of that. Number one, exhaustion is the number one enemy. Exhaustion is so bad that it makes you to forget things that you know, and when someone is reading your notes in the morning, they conclude that you are the most incompetent person simply because exhaustion took over. Not that you are careless, not that you are. The thing is, when you are tired, when you are exhausted, your thinking ability becomes affected. So exhaustion can take away the passion that you have. It can hamper a lot of things, like the extra mile that you want to go for your patient, you being a good team player. So I'm telling you about these three things so that you can guard against them, so that you can be careful about them. So the first one is exhaustion, and exhaustion does not only affect interns. Even MOs are exhausted, registrars are exhausted, but yeah, interns are exhausted. Internship is exhausting. The second thing is work politics. Work politics are annoying. They are not nice. They can actually take away the sting that you have of being a good doctor, of being a doctor that actually wants to be there for the patient, that is a good team player and all of that. The third thing is bullyism at work. It's very big. Bullyism at work is very big. It can also affect you. It can affect your work. It can affect, like I said, it can take away the good doctor that you want to be. It can take away the sting that you have, the passion that you have to practice medicine. So guard against those things, guys. They are there. And when I talk about work bullying, it's not only seniors bullying you. Interns are also big bullies as well. Interns, they bully each other in different shapes, forms, and sizes. Yeah. Another thing that I wanted to say is that as interns, you guys are going to, it's gonna happen. Ne? You guys are gonna fight a lot. By the time internship ends, you're gonna have good friends. You're gonna have colleagues that actually become like family to you, and you're gonna have those interns that you are no longer speaking to anymore because of how the things that they did during internship. The thing is this, guys, in your group you are gonna have good interns, and you're gonna have those interns that are lazy, they are dodgy, they always have stories. I mean, in all the groups there's always one or two interns that always have got funny stories. They don't come to work because their kid is sick, their mom is sick, they got a tire puncture, they were in an accident, different stories. And when you look, you will see that it's just a pattern. It's always the same interns in each and every rotations. They are always not at work because of A, B, and C, and D, and E, and all. So it's so annoying. The thing is, guys, you must be considerate when you do all these things. I'm not saying people must not get sick or whatever, or must not go and take care of whatever that they need to take care of, but be considerate, because if we are 3 in a firm and you don't pitch up, you telling our senior that you're not going to pitch up will not make the senior to come and do your work. The 2 of us will still need to do your work. Remember, it's always hectic. Now, if I'm going to have to do my work and do your work as well, I mean, it's not, the thing is, when it becomes a pattern, that's when it's sickening, and people can be so inconsiderate. And sometimes some of them will even not pitch up for work and not even tell you. You will hear it from your seniors that actually so and so is not going to come. They don't even warn you about it, so you can prepare yourself and all of that. Don't be that intern. If you're not going to come to work for whatever reason, tell your senior, report, and also tell the people that you work with, which is the interns. They need to know that you're not going to come to work, so they can also prepare themselves mentally, physically, and emotionally, and be prepared that actually today I might leave work at 6, I might leave work at 5. I mean, it's so annoying to come to work and you know that, okay, we are 3 in our firm, so if we can push at least by 1, 2, we'll be done. Now, bam, at 10 you are told that, oh, so and so is not around, or sometimes even when you are done, you don't even know whether this person. So guys, the thing is, what I want to say is, it's annoying. Don't do that. Be considerate. And there's nothing as sickening as an intern who has figured out the loopholes in all departments. We had people like that, and I mean, it's not nice, guys. It's just not nice. Okay, one other thing, very important, guys. You are gonna have, the fact that there's a DR before your name now does not really change the kind of a person that you are. If you were lazy as a student, you're gonna continue being lazy. If you were dodgy, you're gonna continue being dodgy. So don't ever think that people now, because there's a DR before their name, they'll be professional and all of that. It doesn't happen. They become the same pattern, the same behavior just continues. So yeah, There's something I wanted to say. Forgotten. So guys, thank you.